Nursing Skill Channel. I am Kalayarisi, Community Health Nursing Department. Today I am going to discussing about intramuscular injection. So before going to give any medications, you need to check the 5 rights of medication. That is first one, right patients, next right drug, right, third one, right dosages, fourth one, right route, so fifth one, right time. So 5 rights of medication is very important. Before giving any medication, whether you're giving injections or medication, see before that you need to check the 5 rights. So right patients means, so you have to identify the correct patients. So patient's name, ID number, patient's medical records, through that you have to identify the patient's name. Second one, right drug. So you need to give correct drug. That is very important. That is mainly you check the prescription, doctor's prescription, then patient's record, then medication label, everything you are checking there. Thereby you are identifying the right drug or right medications you are identifying there. So third one, right dosages. So how much dosage of medications you are going to give to the patients. So that is very important. So correct dosages is very important. To check the correct dosages of medication before giving any medications. You need to give for right dosages. That's very important. So next for right route. So right route means, so which route you are going to give the medication. Whether you are giving for intramuscular or subcutaneous or intravenous. So which route? So which route you are going to give to the medications. That is very important. So you have to identify the correct route of the medications. Example, intramuscular or intravenous, subcutaneous or oral. So which route is suitable for you, which route is doctor is advising for you. So according to that you have to check it and give the correct route. You have to follow the correct route. So next for, so right time is very important. So whatever medications you are giving to patients, you have to follow the correct time. Whether this is before meals or after food or before food. So everything you have to identify. And then some medications for some intervals you are following there, whether 2 hours interval or 4 hours interval. So how much intervals you are going to follow, how much interval is there. So everything you check it before that you need to give the any medications. So you, whether whatever medications you are giving to patients, you need to identify the correct time. That is very important. Some medications giving for before food, some medications giving for after food. Other intervals, time interval is very important. Sometimes 4 hours intervals you are following there, sometimes 2 hours intervals you are following there. So you have to identify the interval, how much intervals you are going to follow while giving any medications. That is very important. So that is very important. So you check the time. First you are going to see the site of the medications.